Welcome back to the Shoulder and Arm Health channel. In today's video, I'm going to be answering several patient questions that we get, including how soon can I have sex after surgery, and other questions related to driving and symptoms that can arise after surgery. Let's jump right in. When can I shower after surgery? So I always tell my patients that they can shower after 3 days. Now, in the case of a shoulder replacement, there will be a waterproof bandage, at least on my patients, and that is designed to get wet, but it's not supposed to be soaked, so I wouldn't go inside of a bathtub or a swimming pool or something like that. In the case of a shoulder arthroscopy, we typically have a big absorbent dressing, which should be thrown away after 3 days, and then you'll find little pieces of tape, and those are waterproof, and they can withstand the flow of water from a shower. How soon can I drive after surgery? There's not really a straight answer on this one, but I'll usually tell my patients that after 2 weeks, they can drive using common sense. There have been actually some studies looking at reaction times and safety, and somewhere between 2 and 6 weeks, patients get back their reaction times and the ability to drive safely. If you're in doubt, ask the DMV. Help, I haven't gone poop yet. Okay, this is a serious one. And jokes aside, if you get constipated after surgery, it can be a real, almost a life-threatening problem. I've had some patients wait 8 days to tell me that they have not had a bowel movement. So if you haven't had a bowel movement within the first 2 days after your surgery, you need to get pretty serious about making sure that happens. In our practice, we have patients take a stool softener immediately, something called Colace. You take that twice a day, and that's to help counteract the effects of the narcotics, which really slow down the bowels and cause constipation. If you haven't had a bowel movement within the first 24 to 48 hours, our top remedies are milk of magnesia, and that's available over the counter. And if you still haven't gone after that, you can take something called magnesium citrate, which is a lot more harsh. But again, it's available over the counter, and most of the time this will solve the problem. Oh, and this one's my favorite. Why is my arm all orange after the surgery? Well, I'm just going to show you something called ChloroPrep. This is a medical grade skin cleanser. It's basically one of the most powerful antiseptics, and it can kill a lot of bacteria. It is actually clear, but it has a little bit of orange dye in it, so that when we paint the arm like this, we can actually see where we've sterilized and where we haven't. Since it's alcohol-based, it will typically wash off after a week or so. If you want to get rid of that color sooner, you can just take some alcohol, put it on a washcloth, and wipe it off. Why is there bruising down around my elbow? I had surgery on my shoulder. So this is a really common one. When we do shoulder surgery, we do all of our work up here. But as soon as you get up and walk around, gravity is going to take all the blood and all the bruising and pull it down your arm, and it usually will settle right here at the elbow. There's a little fascial plane right here, but also you're usually wearing a sling that keeps the elbow into this position, in a bent position. So a lot of that fluid and the bruising will accumulate around the elbow. There's nothing wrong with the elbow. This is just a normal thing that happens after surgery. Why do I have numbness in my hand? So typically when we do a shoulder surgery, we will often give the anesthesiologist will give a nerve block, and so you may wake up and your whole arm may feel like it's numb. And that's pretty normal for the first day or so. After that, however, if your numbness persists, you may have what's called a neuropraxia, where you have a little bruise or a stretch injury to a nerve, and that usually will resolve with time. The other scenario is that many patients are walking around with a mild case of carpal tunnel syndrome, which is a compression of the nerve here at the wrist. After shoulder surgery, as we just discussed, gravity pulls the fluid down the arm, and it can end up causing swelling around the hand and around the median nerve. And that can really aggravate a pre-existing case of carpal tunnel syndrome. So you may not have really even noticed that you had this before, but if you have numbness or new numbness after surgery, you may have a mild case of carpal tunnel syndrome that just got aggravated by the bruising and the swelling that happens after a surgery. One of the best ways to treat this is to place your hand in a splint or a wrist splint, so that when you're sleeping, it keeps your wrist in a nice relaxed position. And then on occasion, your doctor may offer you a cortisone injection. How soon can I have sex after surgery? We know that sex is an important part of all of our relationships, and we want our patients to resume sex as soon as it is safe to do so. The most important thing about a rotator cuff repair is that it takes 12 weeks for the tendon to heal to the bone. For shoulder replacements, it takes about 10 to 12 weeks for the tendons to heal and for dislocation risks to subside. As long as you don't put premature strain on the shoulder by using the arm before then, it should be safe. Most patients can safely be intimate with their partners by modifying and maintaining a safe position. Usually that means being on your back. One study from the Journal of Shoulder Elbow Surgery from 2021 surveyed patients who had previous surgery, and 72% of them returned to sexual activity 6 weeks after surgery. However, some of the patients reported that they took off their slings earlier than they were told to do so, and 7% of them aggravated their shoulder recovery due to this decision. So I know that in the heat of the moment, you want to be able to respond. Just make sure you avoid any active motion of the arm until you are cleared by your doctor. Thanks for watching. If you feel that this video will help somebody, please share it so that they can benefit from the information too.